Hello and welcome to The Connection, where RLDatix's Chief Customer Officer Liz Jones and Medical Director Darren Kilroy are joined by leaders and colleagues from within the healthcare industry. In The Connection, we explore how people and technology in healthcare can come together to create great experiences and support patient safety. We hope you enjoy listening.
Good afternoon or morning and welcome to the RLDatix podcast. My name is Andy Cowper and I'm a journalist who's been writing about the politics and management of the NHS for the past 25 years. And I am delighted to be joined by Will Browne. Will is the Chief Technology Officer for Emrys Health. Will, hello, welcome to the podcast.
Thank you very much. Lovely to be here.
Please tell us in not too many sentences about Emrys Health.
Of course, Emrys Health is a health technology company. We're focused on how do you manage information about patients, how do you accelerate innovation of diagnostics, and then from that, how do you get better outcomes?
That's fantastic. So Will's just taken part in a panel at the RLDatix Connected Health and Care Summit here in Manchester, and I believe that recordings of all of these sessions are available online, so you will be able to catch up on that session if you weren't lucky enough to be here. Will, we're talking on these podcasts about how you make great jobs in health and social care, but give us a bit of background about yourself. How did you come into working on the field of data analytics, and how did you segue into the health industry?
The first thing I remember reading was about data science being the sexy job of the 21st century. And obviously I thought, well, that sounds sexy. I'd like to do that. But ultimately, I think that the pull of data and statistics is the idea that there is some truth somewhere, that if only you have the right tools and capabilities at your fingertips, you can get to the truth. And from the truth, you can make better decisions. And that's really what's carried me through. I think one of the things that made me most interested in getting into health is the importance of those decisions. So whenever a policy has been made or a change in a service, there is a level to which you can evaluate it from how do people feel, what is the general vibe, but then there's also that really tight understanding of did it do what it was said it was going to do, and how can we use data to do that better? And I think that ability to learn and know and improve, that's what's been most fascinating for me. And I've been in data and health the last 6 years or so. And with any domain, the first step is just getting into the detail, the horrible, horrible details of data models, data tables, who's sending what where, and how do those data flows lead to the decision we see today.
That's fantastic. So in that 6 years that you've been working in the health and care industry, what have you observed about the trajectory towards improving people's jobs, making health and care jobs great? There has been an increasing understanding and emphasis on the need to make health and care jobs fantastic ones so that you can attract or retain people. What have been your experiences about what you've seen developing over those 6 years?
So I guess the two things that I think been most pressing for me is one, the need for data capabilities, and that's something I've been talking about and pushing for a long time. The technical ability to use data science technique, combining that with clinical expertise, I think is a magic combination and is really underutilized. And there's still the view that analysts and data are just part of a big sausage machine that leads to dashboards, and the dashboards then are done, somehow magic happens. I think that's incorrect. You need to get people around a table who understand. But the other side of it is the way that technology hasn't made life easier. I remember doing some workforce planning in certain parts of the country and talking to some of the nurses who said, let me show you why my job is more difficult and less fun. And it was just a page on the mobile phone of 38 different passwords and logins for the system they had to use across all of the wards. And it's that kind of counterintuitive thing where we say data is so valuable and will change the NHS and save lives, but the technology we use to implement it is so detrimental to the actual process of caring for people. And so that's the dichotomy I think needs to be unblocked.
Yeah, that's fantastic. So I love the sort of, you've made an allusion to the idea of a self-actualizing dashboard, which is sort of, it is almost a belief in data. I perceive there to be attitudes in some people towards data that it is kind of magic, that there is some voodoo quality whereby we've streamed all these data collections and now we can put them onto a dashboard and that's it. Or kind of, our data's showing really huge problems in this ward and that subspecialty isn't that interesting. So what are your observations about what we need to actually, given that the AI isn't going to make dashboards self-actualizing for a few years still, I think. So what have you seen work well for people who want to take what data is telling them and turn it into how we make things better around here?
I'll kind of repeat the quote there. What wisdom we've lost in knowledge, what knowledge lost in information, all of these things. And the idea that you can get this detached data team, I think you described it well there. There's this dashboard that is the output, and that is very detached from the real world. Well, you don't have that in any other of the professions. Obviously, kind of nurses, clinicians, pathologists, they're all working together in a coherent unit. And there's no good reason why the data science analytics team shouldn't be part of that to support, how do we get the information you need to make those decisions? And so I think it's much more about people coming together to talk and have conversations using their individual expertise, not expecting every clinician to be able to run a machine learning algorithm, nor expect every data scientist to be able to have a conversation about a certain dermatology. It's got to be a coming together of expertise to do the best for a patient.
That's fantastic. So in organizations where you've seen that coming together happen successfully, do you observe there to be any common themes which differentiate the good from the bad, or is it just you have to work with them for a bit and then you work out then you get to tell the tourists from the purists?
I think it's humility in decision making that's most important. Those different perspectives are individually valuable, but together multiplied in value. If you just have very strong opinions which have an inaccurate level of optimism or certainty, you end up making bad decisions. And the sort of humility to say, what does the data say? What do people say? These are all incomplete views. And having people come together with that attitude is much more important than this number's red, therefore you've done bad, therefore go and fix it. Because what that attitude encourages is people not to share information and also people to hide the truth because they're scared of being wrong. And that's an attitude I see a lot, right? I'm in charge of a program. It hasn't worked. That's my fault. No, it's not. It might have been a bad idea from the beginning. You've done everything you can. And that humility to say, we tried it, we evaluated it, it didn't work. Let's move on and do something else.
I think that's fabulous description, which is the role of humility as well as curiosity in having cultures which can probably make the best use of, because data is ultimately a resource. There is, I think, again, a misperception that data being an end in itself, that more is better. And one of the things which I've been hearing quite strongly, I think, across the course of today and yesterday's events here, is an understanding that actually prioritizing the few most important things that your team or your organization would do is likely to lead you to better outcomes than thinking at organization-wide level. The executive will be well informed if we give them dashboard printouts for every subspecialty across every medical division. And that feels to me to be almost, unless you have really highly qualified executives in data science, which I suspect few organizations do, feels to me like a recipe for drowning in data, and almost the peril being that data becomes noise instead of signal.
I think that's exactly right. There's nothing worse than saying I've got 150 metrics to choose from. Therefore, what am I doing well? Am I doing badly? That doesn't mean anything. It's statistics without context are absolutely meaningless. So, I mean, I think where it's actually useful for changing behavior, and ultimately, numbers are pointless if they don't change behavior. Information is valueless if it doesn't change something.
Yes.
That's a really important thing to remember, that most of the information we use has zero value because it doesn't change anything. So what will change things? And I think as an organization, you have your vision, you have a mission, and everyone gets behind that. And the divisions within that need to be able to say, okay, to meet this, I'm going to have a strategic objective, and that strategic objective will have a measurement against it, and that measurement will have a time against it, and we're all bought into that because we then are aligned to say, right, this is how we're measuring our success as a group that aligns with the vision, aligns with the mission, and that's success for us. And that means that if at the end of, for example, we're saying that actually what we want to do is automate 80% of the work that's being done administratively to collect data in the next 6 months. Okay, how do we measure that? Okay, that seems like a useful thing to do. And then 6 months come down the line, how did we do? Oh, we nearly got there. Well, that's progress and change, and that's a good use of information.
Yes, no, I mean, that really does sound very sort of contextually sensible. And 6 months are fabulous time.
I know, what an aggressive time we gave that. Some hardworking people there.
But so if we sort of, I guess, move on to, and you've talked about essentially in the sort of the humility and curiosity context, kind of the culture of organizations in a way. And there's the famous quote, and nobody can ever quite decide where it originated. Some people think it was the management theorist Peter Drucker, who said culture eats strategy for breakfast.
Yes.
And I think one of the things that in the health and care space that has become more openly discussed recently is the importance of organisational culture and maybe team culture and all of those things. And I wonder what we would think was in getting that culture piece to have its priority, because there is a perception, which again I think is perhaps not correct, that data scientists are just people who are fascinated with spreadsheets and means of doing statistical analysis and process control charts and all of these kind of things. But I mean, what you've made very clear is that data should be a means to an end, and that end is improvement of services and people's working lives. What have been your observations about the better performing organisations with whom you've worked, about how they tell the story of getting the data tool to turn into the outcome of people working in different, eventually better ways, given that there's always a hump of pain to be gone over when you change almost anything?
That cultural point, I think, is critical, and that's the intangible aspects of building a team that works. And this is going to sound a slightly non-data science thing to say, but I think getting the little bits of joy from a week, getting the little bits of humour in the meetings, those are the glue that cause the team to want to work together and get up together and to kind of pick each other up when something's gone a bit wrong, but it's okay because there's a level of intimacy. Because my team, we used to play a game on the Friday. Everyone submits something. I think, what's your favourite pet? And we all guess whose it was. And that's just 20 minutes of a day. But it brings people together in a way that lots of very well structured agendas and data organisation doesn't. And so the cultures that succeed are the ones which are being genuine and authentic and get a little laugh occasionally together, right? There's got to be a bit of joy in the workplace. Otherwise, it is just drudgery. And it's a very intangible thing to talk about, but that joy, I think, drives a lot of what makes great organisations great.
And so you currently, obviously, in the process of developing your new organisation, where you are the Chief Technology Officer. What have you most productively learned from your sort of past experiences with other, you've done some consultancy, I think, and a variety. So you've worked with a spread of organisations. And of course, you can learn both positively and negatively from working with organisations in the health and care space. What are the main things that you've taken into your current organisation's development and sort of progress?
I think, again, the softer things are just as important. Evidence-based decision and all of the statistical robustness, that's kind of taken for granted, right?
That's the price of entry.
That's the price of entry, right? The things that's not is how, as we said, kindness to people is the first thing. Human beings are human beings first and foremost. They're not human resource. They don't have a role. They aren't that. They're a person. And that's how you connect with people day to day. And ultimately, there's got to be a drive. And people, there's all the soft nothings, but really wanting to get up and do something and getting excited and feeling that energy, that buzz exists in some places and it doesn't. And again, it's very intangible. I think it's partly to do with them enjoying what they're doing together, partly them feeling their trust. But that buzz you sometimes get, that's what I think we're striving for, because if you get a call at 2:30 in the morning because something's broken, you need to get up. You've got to want to get up and do that. And it's got to be important for you to look at your phone and go, oh God, I've got to fix that. Not, oh God, I've got to fix that. And that's what I think you've got to try and create.
And in terms of the health and care system being generally a pressured working environment, what do you perceive as being the role of getting the 9-password logins type stuff out of the way to release people to do the thing which first originally motivated them to come into working in the health and care space? What's decluttering, data collection, data manipulation? How big a priority do you think that is currently, and how big a priority do you think it should be?
I think we haven't measured the scale of that problem. And I think that's probably, I've seen it in other parts of Europe, and I think Germany's done some very good studies on this. But I think the first step really is we need to quantify how big of a problem in the grand scheme of efficiency within the NHS, which we've said is our basically number one priority. To what extent is the technology aspects of not being integrated causing these problems? And we've kind of hinted at it. We've said it. We said capital investment needs to increase. We need to have the technology. But that very specific thing of how much time is wasted every day by people on the front line logging into things because of slow equipment, that needs proper quantification, because then I think the business case will be overwhelming.
I think that's absolutely correct. So I guess just one final query is essentially, where do you see the quick, improvable and achievable and affordable changes coming in the system broadly? I mean, we have to talk in generalities because otherwise you'd be kind of going this sector and that sector and the other sector. What do you think could be done reasonably soon without spending too much money, which would actually almost start the snowball rolling of improving how data is used and essentially leveraged to improve things?
I don't know how realistic it is, but if every ICB merely had a catalogue of everything they were trying to do across each program, what the success criteria was, and when they were going to judge whether it was successful, that would be a small thing. But if everybody did that, we would have 42 places doing 42 things, maybe 5 in every 42 work. But then we can scale that and spread that. And at the moment, we don't have a methodology to actually spread and scale things that work. And we also don't have a methodology to turn things off that aren't.
That's fantastic. I think we've covered quite a lot in our 20 minutes together. Thank you very much indeed for taking the time to come and do this. Will's panel session is absolutely worth watching. I hope you'll go to the RLDatix website and you can download it there. Will, thank you very much indeed for your time. I'm Andy Cowper, and thank you for listening.
Thank you for joining us on today's episode of The Connection. We hope this episode has provided you with valuable insights on the role that both technology and people play within the healthcare landscape. For more information and resources, visit RLDatix.com. Don't forget to subscribe to The Connection on Apple Podcasts, Spotify, or any other podcast platform you use. Join us next time as we continue to explore how healthcare is impacted by connecting people and technology. On behalf of the RLDatix team, thanks for listening.